The video. That's it. That's the. So today I want to share an experience I had in my clinic, and this video is actually for clinicians, for people practicing, yes, like working in clinic, working out call, whether in the clinic or so, practitioner like veterinary practice, that have veterinary practice, or you are practicing one way or the other as a veterinarian. This video is for you. So I had a puppy, a Lhasa Apso precisely, that came in for vaccination, and the puppy is just about, let's say, 2 months old. Yes, 2 months old, because the owner could not actually give us the full days, like the full days of birth of the puppy. So estimating it, the puppy is about 2 months old. It has received, yes, the first shot. He said it has received the first shot of the vaccine, so it actually came in for the second shot of the vaccine. Ideally, normal thing we do: examine, is it fit, ask question, hope it's okay, it's fine, before vaccinating, which I did. I was given opportunity to play with the puppy, like very very happy, cute puppy. We were playing around in the clinic, and boom, it was time to vaccinate. I brought out the vaccine from the fridge as usual, aspirate it, mix it, the DHPP and the leptospirosis, and gave it to the cute puppy. Just about maybe 5 to 6 seconds after I finished, I also noticed the puppy was kind of weak, like restless. I could spot that the tongue was becoming cyanotic. Yes, it was cyanotic, and it was bringing out the tongue a little. I was trying to play. Open your mouth. I opened it. I saw that the tongue was already cyanotic. It was like darkish. You understand? Like somebody trying to look for oxygen. You understand? Being deprived of oxygen, kind of. I tried to put my hand inside the tongue just to make a little bit of pressure on it to see if there is still blood flow on it. But funny enough, it was still there. I began to examine the puppy, and the owner was there. The owner was there. Honestly, I've never experienced it. This should be like my 5th year in practice, yeah. And I've been vaccinating dogs, puppies consistently, and I've never witnessed this. Yes, I've witnessed some kind of antibiotic reaction, hypersensitivity reaction, but not with vaccine. Yes, not with vaccine. I've never experienced it. So I immediately went back. You understand? I went back to check the vaccine. I gave the correct vaccine. Yes, this is the vaccine I've been giving all that. This that I gave at rabies or something. I don't know. So I went back to check it. It was the vaccine. What could be the problem? The coaching fine, everything okay. What could be the problem? I've vaccinated a dog like a day before previously, and nothing happened. So why? A dog that was very active, and that kept me wondering. The owner was there. He also felt like, oh no, doctor, don't worry. It'll be fine. Maybe I was like, maybe he's reacting. Yeah, I knew that they can react, you understand, but with my years of experience in the veterinary profession as a private practitioner, I've never experienced a vaccine hypersensitivity reaction. I personally have not. You might have, but I personally have not. I've witnessed some with maybe antibiotic and other medication, but not with vaccine. I began to be like, oh my god, puppy be okay, please. You could see me, like, it wasn't funny. I don't know how to explain it. It wasn't funny. Then imagine the client trying to console you, the doctor. Ah. But the good part is that I took the puppy, I was looking at it, and honestly, in my mind, I was like, oh, what next? this could be a reaction. So I just took the puppy a little bit to a more airy place, like underneath the fan. Yes, that was what I did. I tried opening the mouth, make sure I open the mouth very well, place my hand on the tongue and just notice if there's any reaction, and just place the dog underneath the fan directly. And I was like, in my mind, but I was praying. I was like, God, please. The puppy that get very healthy just for vaccination, it was not sick. Oh. So, to cut the long story short, the dog started reviving, playing. He even pulled. He pulled, like, he pulled. I was like, okay. After pulling, it was a little bit, yes, it was much better. Very much better. And then we started noticing improvement, the tongue coming back gradually. It took us about, it was like 10 minutes, yes, for him to be at least a little bit, like, much better. So I can say, I know he's back. And that was when I was like, what? I had to make one or two inquiries, you understand? You know, we keep learning every day, and that's why I'm making this video. We keep learning every day. You might have not experienced it. You might experience it one day, but this video is coming timely for you to know that, yes, there is something like vaccine hypersensitivity reaction. Yes, it can happen. I witnessed one with how many years in practice. This is the first time I'm witnessing vaccine reaction. Yes, you might notice that maybe, I'm not saying this local reaction that maybe some you notice a swelling at the site or maybe antibiotic, but vaccine, I personally have not experienced it, and this was not a funny experience for me. So in case you experience this kind of someday in your practice, do not fidget. And it happens mostly with small breeds of dog. Yes, maybe the Lhasa Apso, Eskimo. Small breeds of dogs are prone to vaccine hypersensitivity reaction, and there are things that you can do. The first and most effective thing you should always have in your clinic is epinephrine. Yes, once you notice that, you can give a little bit of epinephrine to your dog and it will actually calm down. And then also, some persons might have had this experience before. When they come to you and there's an history of vaccine hypersensitivity reaction, you can give an antihistaminic, yes, antihistaminic drug like chlorpheniramine. Yes, you can give that, but better still, the best option is for you to have epinephrine. And from research that I got to know is that it is mostly it is from the leptospirosis vaccine that the dog actually react to. If you have the one that is separate, that's the DHPP, you can give that separate. Then maybe after some days, maybe 7 days, you give the other ones. So that's how it is. I hope this message is timely for you. I hope whenever you experience it, please do not fidget. It's one of those things you experience in the clinic, and there are ways to go about it. Just try to calm your clients down. Do the needful, get your epinephrine and give the shot. Of course, you calculate the dosage to the weight of your animal, to the weight of your pets before doing. Thank you. Snow. Snowy.
Oh yeah, come here, come. Sit. Good boy. Snowy.
I don't know,